Do you know how to use email in terms of communication with patients in your practice? Recently, Matt Hancock, the Secretary of State for Health and Social Care, made it clear that email should be a method of communication with patients moving forward, particularly in the wake of getting rid of things like faxes and more recently pagers. But how can you do this as a practice? Some practices out there have already led the way, others feel clearly apprehensive about this method of contact. Well, in this video we're going to show you how you can take into account some of those aspects and how you can make that process a lot easier. Let's tech enhance your primary care and learning. If this is the first time we're meeting, I'm Dr. Gandalf of EGP Learning, where I look at supporting you with technology-enhanced primary care and learning. And in this episode, we're going to look at the various different ways that you can use email as a method of communication with patients and the various different things you need to consider when you're using this method of communication. Some of this is also applicable to text messaging, so SMS messaging and that kind of stuff, so useful in that respect as well. If you want to follow our page, obviously contact us at EGP Learning on Facebook, YouTube, or Twitter, or always contact me directly at Dr. Gandalf52 on Twitter. Make sure you subscribe and ring the bell to get notified of all of our information first and foremost. And like I said, let's tech enhance your primary care and learning. Shall we begin? So in this video, I'm going to talk to you about how you can use email in your clinical practice, either as an individual or more importantly, as a practice or surgery. There's various different things you need to consider, and there is some pretty decent guidance out there by NHS England, which the link is included in the show notes. In terms of how you look at this process, well, there's various different stages that I would recommend having a look at. So you've got your setup, your sign up, your disclaimers, and your clinical use. So we're going to go through those areas in part, okay? So when you're looking at sign up, important things to remember is which system are you going to use. So there are a couple of authorized email providers out there for use for clinical information. So this includes nhs.net and Office 365. There is guidance out there that exists to authenticate and approve other email services, but they do need to comply with the relevant guidance and stuff. And that guidance again will be in the show notes if you want to have a look. But those two are definitely off the bat able to use and stuff. So it's important to consider how you can use them. When you do use them, it's important you know that you've got the right inbox kind of levels to use these kind of data. So for example, you may want an inbox for prescriptions, you may want an inbox for appointment confirmations and stuff, and just basically patient-facing inboxes compared to the more specific one that you may use for other organisations to receive your information, such as hospital discharge summaries, information from anti-coag clinics, other service providers and that kind of stuff. And I think it's important to have different processes for those kind of different cohorts that you're looking after. The other thing I would suggest is for those patient-facing email boxes, have in the email address itself clear what it is. So for example, prescriptions at practiceX at nhs.net, or alternately you could have something like appointments at surgery Y at Office 365, for example. So just so it's clear when the patient gets that email, they know what that is for and who it's from. Other options in terms of that are very important to consider is actually who and how you're going to process these emails in your practice. Some people think it's easy to just switch it on. Doing email personally is very easy, but actually doing this as a practice and the workflow that you're going to have to consider will be very valuable. And also making sure you've got the time to do it. This is an additional communication route that you will have. So factoring that in terms of how you're using the clinical aspects and stuff is very important. If this is a system change in your practice or something you've not done before, it may be worth considering how you're going to look at doing this. So are you going to start small, just do simple little things, for example, such as appointment confirmations, or are you going to go the whole way and do everything all in one go? It's important you look at your resources, look at how your workflows are, look at your workforce to see how you're best to do that for you, as well as for your patients. I would always recommend testing the wording that you're using in terms of these letters with the various different groups that are around you. So such example as your patient participation group, indemnity companies, and there are other organisations that may offer you help. So for example, things like Health Watch and that kind of stuff, or even speak to other practices about what they've done so that you're not having to recreate the wheel, basically. And in terms of actually making this change, I think the other thing that's important to consider is how you're going to advertise this to patients. So are you going to put displays up in the waiting room, for example, which would be a common sense kind of method of doing it, but other methods are using your own social media presences like your practice Facebook page or Twitter page, engaging with your patient participation group, or going to other organisations that may be able to help you. A really good method: put it on the prescription counter for that you've started delivering this service to patients, and that may pick up some extra ones for you. Just like we would when we're telling patients, consider making sure you got your prescriptions covered for Christmas and that kind of stuff. Helpful way of doing things. Don't forget that email communication is a part of the clinical record and needs to be treated as such. This doesn't mean that you have to put a copy of the email in every single part of the record, but if you're using templated emails, it's easy to conform how that's going to happen, but make sure you've got a system of tracking that quickly and effectively. So for example, presets or templates that allow staff to say this information was sent at this time quickly and effectively through the clinical notes. Some clinical systems do integrate with email a little bit better than others, so it's worth looking at what you have and how that will work. And another little tip: consider using mailing list providers. So there are a variety out there. It is worth checking with with your IT governance provider company and things, how that will work for you and whether that's appropriate to use, because don't forget that may mean storing your information on other servers, and it's important to factor that into the consent and stuff. But they may be able to provide services that allow you to run that email system a lot more quickly, effectively, and to be honest, more patient friendly as well. So have a think about that. Definitely get advice in terms of which ones are the best ones to use. I've not been able to do that myself yet. Something to consider though. The important part of this process is the sign up itself. So when patients actually go to start using this service, and things to consider at that point is how that's going to work for the patients. It's important to remember that you're abiding by standard regulations like GDPR in terms of patients using that information and knowing what they're consenting to use. So a good idea is to have a simple form or automated process that has, the information out there for them to have a look at. And I'd also include putting a little bit of information about the disclaimer that we're going to talk about shortly, because then at least the patients know when and they should and shouldn't be using those services, and they're signing up to that properly. A little tip of mine: all those kind of information about the disclaimers, the rules, the way that patients should use this, make it a patient-facing web page as part of your website that they can look at any point. And the important reason for doing this is that if all of your disclaimers and rules and everything point to this one page, you only have to update that one page so that it's actually clear to all how that system works for you in practice and for patients, and it's easy to reference to. The other thing I would also put in that information is in terms of how this information is going to be used. So are you going to be sending the patients information about their results? Are you going to be sending them information about their appointments, that kind of stuff? Have that information in that kind of web page as well. Another thing to consider is how you're going to make this process easier for your staff to get patients on board with using their emails. So a good tip is using something like templates or auto-consultations or macros to make that process easy, quick and effective for both the staff, so then they can support your patients. And also it means that it takes less time so that you can actually get more patients on board and stuff. It's important that when they do sign up that you have a test email or message, because this could be used for mobile phone messages as well, that's sent out to the patient at the time that they sign up. This should be easy and quick to do within the systems itself, but making sure that's there is important. Specifically for email, another thing that should go out in that test email is a concept of how to whitelist the emails from the practice. What does that mean? Well, when you sign up to an email provider, it's important that you want to receive those emails properly and not end up in your junk folder. And depending on how tight your privacy filters are, that may happen. So a way to prevent that from happening is a concept called whitelisting. In the show notes is a link to a website that shows you how to do that for majority of email providers, and it may be worth providing that to your patients. I've no involvement in that particular site, but I find that it's a really effective way of making sure that the emails get to the patient how you want them and stuff. Another option is to possibly suggest that the patient creates a folder in their email account to make sure that when they are getting those emails and stuff, that it's from the practice, and thinking about filters to help them do that so they know all their information is in one single place. Something to consider. Have a look at that and figure out what's best for you, what's best for your patients, and work with your PPG to get that advice as well. The next section I wanted to talk about was disclaimers. I think this is an important part about protecting both patients as well as protecting the practice in terms of using emails clinically. One disclaimer that's very important is making sure that the patient is aware that once they've received the information from the practice, it's their responsibility what happens to it after that point. Practice cannot be responsible for what happens to that information once it's in the patient's inbox and they've read it and used it. For example, if they want to share that with somebody, that is their choice. That is not the practice's responsibility to take over at that point. NHS England even make this quite clear in their documentation and stuff. An additional point is maintaining the integrity of the information that you have. So for example, is it the same mobile number? Is it the same email address? This again is the patient's responsibility, because I'll be honest, we don't know if they change their email addresses or their phone numbers. They need to tell us, and to make sure that they still get the information they want until they tell us, we're not going to know that. An additional point to put in the disclaimer is that commercial email providers, things like Gmail, Hotmail and stuff, are not considered as secure as systems like nhs.net, Office 365 for example. So it's important creating a line in that disclaimer that says that although it is a small risk, there is still a risk that that email may be intercepted or hacked, and that the patient needs to accept that there is this small risk there. Worth putting in the notes and stuff to make sure that they're aware of that. Also, in the disclaimer, worth putting in a line about which members of staff will have access to the information that patients may send and stuff. This is important because it may help to prevent a complaint in the future, because sometimes patients don't understand the working mechanisms of a practice and how they may work, and they may say, well, why does the reception staff know about this email? It's completely appropriate for that to happen, but making it clear why that's happening is a very valuable step, and this is a great opportunity to do that for patients, both protecting them and yourself. And the final thing I would definitely recommend putting in the disclaimer is making sure that it's clear to patients that you would recommend that they use a personal email address or mobile phone number for communication methods. Using such as like a business one or a family one is still the patient's choice. They have that right to make that choice, but obviously raises issues in terms of confidentiality as to where that information has been delivered, and the patients need to understand that prospect and things. So putting that in your disclaimer is very important, I feel. Another aspect to consider is the concept of something called no-reply email addresses. Now, generally speaking, the view is that these should not be used. However, in clinical use, I think they have significant value because of the way that we receive information. So a great concern that many people have in terms of email use for patients is, what if the patient replies or contacts us saying they're having a critical health issue? Now, because these emails are not monitored 24/7, they may only be checked at various points throughout the day, or obviously if the practice is closed, it may not be checked for a while even. How do you manage that? Or the other option is, what if the contact is made is inappropriate? So for example, a patient puts in a prescription request, but also adds in a clinical question at that same time. Well, actually that email may go to the prescription clerks who are there to manage the prescriptions and not deal with the clinical aspects. So having a process to deal with that is important. But also making the patient aware of the best method of contact is also important, and a great way of doing that is using what we call no-reply email addresses, so that when the patient replies to an email or sends an email in, they get an automatic response near instantly that explains to them the various different things they need to consider. I think one thing that's important to remember is to have the address correct for this kind of thing. So a lot of people would say, do not reply at practice, for example. I'd actually say make it a little bit more personal. It may help a bit better. So practice Y says, for example, or Dr. X at practice Z says, that kind of thing. It just makes it a little bit clearer in terms of where that email is coming from and distinguishes it from other business kind of emails and things. And it's also important about using the wording. Various different ways you can do this, and there's some examples in the show notes and stuff that you can have a look at. But what I would always recommend is, first of all, thank the patient for their contact. Make it clear that the contact may be inappropriate and that there's better ways of making contact with the practice for various different things, and then signpost them to the appropriate resources, such as either phone contact with the practice, contact via the website if you're predominantly using e-consultations and that kind of stuff, or contact via 111, for example, for out-of-hours care and that kind of stuff. So making sure those are clear. I've given 3 examples in the show notes, so feel free to have a look at those or create your own. And lastly, I wanted to look at the clinical use of emails via practice and stuff. This is obviously a key thing that many people feel a little bit unsettled about at first, but actually can be quite effective, and there are various different ways that you can look at doing this. First of all, abide by all the principles we've already talked about, such as making sure you've got workflow time for this, making sure you've got the relevant systems in place to tackle these kind of things, and making sure you've got processes in place to make sure this is handled properly. Next, it's important to remember that email is actually a good method of communication in certain circumstances. So for example, sharing information about service delivery, sharing clinical resources with patients, for example, and also other kind of things like reviewing a patient after you've started treatment. It may be effective just to say, Hope you're doing okay. Is the treatment working? Yes or no. Something simple like that. However, it's important to recognise that this process may not be monitored 24/7, and instilling that in something like an autoresponder email when a patient makes contact is important. So, for example, something like this email address is not monitored all the time, and you will have a reply within 24 hours, for example, which is actually the NHS England recommended time frame. I'd probably adjust it slightly and say that 24 hours is reasonable, but also including this does not include times such as weekends or bank holidays when the practice may be shut. Personally, I would not recommend using emails for new problem consultation methods because I think that can be more challenging and there's a bit more of a to and fro kind of aspect and stuff. So important to recognise that, but could be instilled with programs like e-consultation methods and that kind of stuff, which are more triage kind of systems. They are different things, so important to recognise that. Finally, make sure that any reply emails that are sent out by clinicians have signposting to all the standard kind of things in the footer, for example, like the disclaimer, like the rules about how to use email and whitelisting and that kind of stuff, to make sure that all that information is reiterated and shared with patients on a constant basis. I hope you guys have found this session useful, very relevant in terms of some of the changes that have been recommended recently. And as always, I'm more than happy to hear your comments and feedback in terms of what you think about this. There are definitely going to be practices out there that have been doing this for a while and may have better experience compared to myself of how to use emails with patients and that kind of stuff. I'm keen to hear what you think and how you think this may be useful and stuff. As always, if you want to find out more information, make sure you subscribe to our channel. So there's a YouTube channel, GP Learning, and make sure you click on the bell to make sure you're notified of all of our new episodes. Alternatively, obviously, you can watch us on Facebook or contact via email, Twitter, both at EGP Learning and at DrGandalf52. Make sure you subscribe to all of our channels so that you can get the information when you want it and stuff. I'm always here to try and help you guys. So as always, comment, share, and let's tech enhance your primary care and learning. See you later. Bye.